In the 2 or 3 months after our mother died, we learned of 3 other people in sort of the small Brooklyn neighborhood that we grew up in and where our mother lived, who died of Clostridium difficile infections. A key thing we want everybody to know is that C. diff and C. diff infections are largely preventable.
I would like other people to know that C. diff is real, that it's very severe, could be deadly.
I'd never heard of C. difficile, and she said the good news is that we know what it is.
I was shocked when I found out what happened. I had no idea of C. diff and what it was or how could it affect someone.
I think it's important because it's happening a lot more often than people are willing to talk about.
You know, when we were at the hospital, my brother was on his phone, on a laptop, trying to find out what C. diff is. Couldn't find nothing, you know?
The information that we did find was medical journals. It was an article on the CDC. All of it said that this happens to elderly, immunocompromised people, not a healthy 56-year-old woman.
So C. difficile used to be thought of solely as a hospital-acquired illness. And what we're seeing now is that C. difficile is appearing in the community.
And once we started talking about it, we heard from doctors and people we knew that this was a disease that was changing. It was no longer just affecting the elderly and people who are otherwise sick, but it was something that was increasingly seen in healthy people, in pregnant women, in children, and that it was increasingly taking the lives of people.
Her philosophy on life inspired me. It opened a door to help me help other people become aware of C. diff.
She was all about education and knowledge and being your own best advocate. And you can't be your own best advocate unless you have the information.
We must be more informed about C. diff. It's a serious condition, but with knowledge, you know, it can be tackled, it can be brought under control.
One of our first goals in starting the foundation was creating an internet hub for people to find information plainly written that they could understand.
What is the foundation doing to address this epidemic?
Primarily, we're involved in public education.
That's our goal, is to at least get this message out there to the other professionals, to know that an antibiotic isn't always warranted, isn't always needed. And when you do prescribe it, make sure you're prescribing the right type, the right dose, and give the patient some education about what to do if these symptoms should occur.
From a public health standpoint, it would be useful and helpful to have increased funding for research in the diagnosis and treatment of Clostridia difficile so that we can learn how to optimize treatment of patients who acquire it and prevent others from acquiring it in the first place.
We're always coming out with different cutting-edge treatments, whether it's a safer, more effective antibiotic or probiotics, having more medical professionals kind of marrying the two to get more long-term results.
The booklets and bookmarks that you have found in your seats also contain information about C. diff. We want you all to take them home, learn about how to prevent and combat this disease, and spread the word to your friends, families, and doctors.
It went over great. You know, we had a lot of people there. We raised a lot of money. We raised a lot of awareness.
We support this foundation because we think that they've tapped into something that can go places.
I think the foundation has taken on major leaps and bounds in this 1 year. It goes in a fabulous direction. I agree with what they're trying to put out and how they're doing it.
This is something that we can fight. If we measure it, if we study it, if we report it, and if we agree that we're going to not let people die from a preventable disease, we can change it.
Help end C. diff now.
Please go to peggyfoundation.org.